The Saint Lucia Medical and Dental Association believes Victoria Hospital should be the first choice for a respiratory institution in the likely event of COVID-19 cases. Last week, former Chief Medical Officer Dr. Stephen King dismissed Prime Minister Alan Chastain's suggestion of Rat Island as a possible quarantine center. Medical Association President Dr. Merle Clark asserts that Saint Lucia should consider completing the long overdue move to the state-of-the-art OKEU National Hospital as a preventative measure.
The large majority of patients are up here. The large majority of physicians perhaps are up here. Of course, if you need to move in time of crisis, you do that. But we just think it's simple. VH is right there. We know what is available at VH with all its failing infrastructure. We know what is there. We are familiar with it. And when King EU Hospital, we've done enough tours of it. Also, we know what is there. So we believe with all the potential glitches that are there, we do need to move perhaps our current inpatients in there and use VH as a respiratory hospital. So
the Health Ministry is awaiting COVID-19 testing equipment. The opposition leader criticized the government for failing to procure these vital tools at the outset of the global outbreak. However, Dr. Clark says the focus should not solely be on testing, but curbing COVID-19 transmissions.
Even if you're tested and it says this person is positive for COVID-19, the supportive care is not necessarily going to change. So in as much as it's important to test, particularly patients who are not symptomatic and who could potentially be spreading an infection, we want members of the general public to focus on what you're going to do to protect yourself and to protect your family. So the testing for us is important, but it is not the most important thing. If there is a case, you need to know how to protect yourself and what to do.
The association is adamant that everyone must play their part in preventing the spread of the virus.
It's washing your hands, cough etiquette. If you're unwell, you need to stay home. Ensure that, so hand sanitizers, my understanding is that hand sanitizers in the stores are quickly running out, but there's a whole lot of soap left. I mean, the primary thing essentially is to wash your hands for 20 seconds. In the absence of that, then certainly use hand sanitizer. But it is important. We touch our faces unknowingly, unwittingly. It's important that our hands be clean, that we don't transmit or make ourselves sick, not only for this, but for the flu and for so many infectious diseases, gastrointestinal diseases, because you can't be speaking only of that. The other things are still around.
The medical professionals continue to stress the importance of basic sanitary guidelines. The World Health Organization confirmed that as of Saturday, March 7, 2020, over 100 countries had reported cases of COVID-19. Gina Filippi, HTS News Force.